Good morning, Sarah. We are very happy to have you on our show for the Pathway to Precision Medicine channel. So could you please introduce yourself for our community?
Yes, my name is Sarah Wamala Andersson, and I'm a professor of health and welfare technology at Mälardalen University in Sweden.
Thank you very much. Could you give us your personal definition of precision medicine?
It's very interesting, and of course, for me, who is interested in bigger issues. So for me, precision medicine is about, if you think about new innovations in medicine, they start in a lab, and you go through different phases, then it's ready to come out after phase 3. For me, precision medicine, if you take a pharmaceutical treatment, it would be a good example. Then you have to take it out to the market. So precision for me is about how do we reach the patients who haven't been part of the clinical trials, which have been nicely, designed. How do we take care of the patients with their comorbidities and all factors around them, household, personal, community factors, but also the socioeconomic conditions, which are very important for determining how you get that medicine, regardless of who pays for it. And finally, get it into your body to really make a difference and bring a difference in health outcomes. And continue doing that, as the doctor says.
Excellent. Excellent. Could you share with us one or two experiences or initiatives that you were involved in the precision medicine perspective?
Well, we want to bring into prevention. Now I use the pharmaceutical treatment, but we have to remember that most of the improvements actually happen outside this pharmaceutical, treatment.
Right. That's right.
So when we think about precision health, where we've been working on, so we think of how do people keep themselves healthy? Yeah. And if they get any risky factors, that those risky factors don't turn into illnesses. Yeah. So how do you bring precision into having a person keeping themselves healthy and keeping risky factors away from becoming illnesses? Then we are talking about broader determinants of health. And then the precision comes in to reach each and every citizen who become a patient sometimes in a way that actually addresses the conditions of that person, given the broader perspective of where the people live and work and having many other relationships going on.
That's very interesting. You touched in your talk that precision medicine should serve the most, not the least. So, and I know that you work a lot on this north-south region. So, for you, what is the biggest challenge to bring precision medicine to the masses, rather to the IV institutions?
Yes, and then now we are talking about population health, as we say in public health. And of course, population health, when you start to go beyond borders, then you are talking about global health. Yeah. So when it comes to global health, you know that we need to think that we have almost getting to 8 billion people around the world. And when I look where I live, in Sweden, for instance, we are about 10 million. And when I travel to Africa and Asia, we are talking about billions. And also we have to remember the demographic is that the demography of Europe and the US and Canada and some Asian parts that we have aging population. And when you go to Asia, Africa, some Middle East countries, so you will find that many young people in Africa, for instance, 70% are under 30 years. So the question is, when it comes to precision health, how do we make sure that those young people will be useful in the world to get there? Because most of them are very brilliant. Yeah. How do we use their gifts to bring to the world to solve the problem that we have within healthcare, but also within society? So for me, precision would be addressing broader determinants of health that will affect the population health and global health. And I think the global digital health divide will be in skills. So we need to talk about fit-for-purpose training. of young people, but also those working within the healthcare. But also we need to think about how do we make technologies accessible to all who need them.
That's great, amazing. One last question. We all agree that precision medicine is an interdisciplinary endeavor. Why do you think such events could contribute to build communities that are working on precision medicine?
First of all, I need to congratulate you, Professor Tibani and Beckley, for doing this conference, because I think we need meeting places. I talked to many young people here who are doing medicine, and I was thinking, wow, this is amazing. If I was a young person going to medical school in my 20s and have the opportunity to come to this conference and listen to what is going on, breaking through, you know, research, really targeting pathways to precision medicine, what would that mean to me? So I was thinking that what you are doing here is amazing, to bring people together from different scientific disciplines, because that's what we need, to talk beyond scientific disciplines, that, you know, medical doctors don't just sit with medical doctors and epidemiologists, you know. So we need the cross-cutting engineers talking with the healthcare professions and all that. And what you are doing here is amazing. Thank you very much.
Thank you very much, Sarah. It was a pleasure to have you on the channel. Thank you very much.
Thank you.